Sahani sir. Good evening, good afternoon, and good morning. This is the 1519th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. BAINU Sharma from. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over. That is our Hindi session from 7:30 to 8:30, and from 8:30 to 9:30 we have the international session in English, and 9:30 to 10:30 we have a local language session in Malayalam. All the sessions are going in a good way. We have doctors from 85 countries participated in the sessions, and they have presented various papers on different subjects. And today we are lucky to have a wonderful guest in Dr. BAINU Sharma, and she is the professor and Department of Veterinary Medica, JIMS Homeopathic Medical College Hospital, Hyderabad. And she has more than 22 years of clinical experience and has been one of the best teacher in the college as well as in the university. And she has won many awards, and she has written a lot of articles and presented various papers in different seminars also. And as you know, a very important subject is being discussed here, that is the art or skill of observation in homeopathic practice. As you all know, that homeopathy is an art as well as a science, and one need to look into the artistic part as well as the scientific part and connecting between both those things together. So one thing one need to look into the observation. What are the things you see in front of your in front of you, as well as what are the things you observe, whether what kind of smell, what kind of action, how the patient is walking, how the patient is looking, how he is talking. All these things need to be looked at. So let us welcome Dr. BAINU Sharma for this session. As you know that we have this being a big subject, we will have some 2 to 3 editions of the same. So we will have a second session. The continuation of the session will be on 4th of November itself, so that everybody can watch it, the continuation of the program on that day also. So hope all of you will be with us all these days of the presentation. So proudly we can welcome the guest of the day, Dr. BAINU Sharma.
Thank you, sir. Thank you for welcoming me. Thank you for such a wonderful introduction. Am I audible, sir?
Yes, everything fine.
Everything is fine. A very good evening. Namaste to all the homeopathic lovers, to all the listeners. And myself, Dr. BAINU Sharma. I am a professor currently working in JIMS Homeopathic Medical College, Hyderabad, Telangana. The topic for today, which I have picked for you all listeners, is the art and skill of observation and its utility in homeopathic practice. So let us start sharing the slide.
Yes, it is visible.
The slide is visible.
Yes, everything fine.
Very welcome to all the listeners. And let us focus on the observatory skills while taking homeopathic cases. In today's world, in today's medical field, there are lots of diagnostic tests available. So the doctors are making these diagnoses, keeping all their diagnostic skills dependent on all the tests available. So if we are focusing more on these tests, the necessity of observation has decreased a bit. It has taken a backseat in the medical field. So this skill of observation is also slowly disappearing. The diagnoses which we make, they at times we miss them. The diagnoses which we make, at times they are delayed because of our dependence on the diagnostic skills, diagnostic tests, rather than our investigation through our medical senses, which we have learned in our college days. We lack focus, we lack deficiency in case workouts, we lack case analysis. So that is one reason, because observation has decreased gradually. It's taken a backseat. I've picked this topic of the art and skill of observation and its utility in homeopathic practice. So before going to the right topic of the day, I just want you all to know about this famous story, The Student, the Fish and Agassi, written by a student, which has become a classic lesson in the value of close observation for analysis. A very famous ornithologist, a very famous botanist, Dr. Louis Agassiz, was in 1850s somewhere, a teacher in college somewhere in America. So he was a PhD guide of this student. And his way of teaching to his PhD scholars was very, very different than other PhD guides. And it was very different at that time compared to the other fellow physicians and fellow scholars. So what he used to do is, he used to ask his PhD scholars to sit in one room, one blank room, with all the subject and nothing else. One table, one chair, one petri dish with the subject in that to be read, to be understood, to be observed, and the PhD scholar. That's it, nothing else. So this scholar was very, very enthusiastic. He was very happy to have Louis Agassiz as his PhD guide. And he asked his guide, what should I do? So the guide gave him a petri dish, kept a fish in that, and left it on the table and asked him to go into that room and sit and read that fish. And he asked the student to come looking for him after he understands something about that fish. The professor goes out, the student is there with the petri dish, looking at the fish. He looked at the fish, he looked at the fish for 10 minutes, he got bored, he went back to his professor. The professor said, what is it that you have learned? He said, Professor, I know it's a fish, nothing else. It's a fish like a usual fish. He said, it means you've not observed anything. You go back, have a look, have a look, have a look. So he repeated, look, look, look. He went back into the room. He started looking at the fish. Again, he became bored. But then he was very, very adamant and headstrong that whatever it is, today I learn about this fish. There are so many things I feel which I'm missing because my professor is sending me again and again to the same room, alone in that fish, alone in that, cabin. So it took him almost 80 long hours to understand gradually the importance of observation. Because besides understanding the phenotype of that fish, the physical appearance of the fish, he started learning the behavioral pattern of that fish. How the fish changes its behavior with the change in the temperature of the room, how the fish changes its behavior with the day, with the sunset, with the sunrise. Then he went to his professor and told his professor that this is what he has learned. The professor was happy. After 1 year, the same student drew that same fish on the board with a chalk, and the professor enters the room, and the professor says that this fish can be drawn only by one particular student, and he recalls the same student. Everybody says, yes, he is the student. And that student was then given 4 or 5 more fishes on the same table by the same guide. And this person, this PhD scholar, was able not only to recognize this fish or tell the qualities of this particular fish, but he was able to demarcate all the major differences between this fish and the other fishes. So over a period of time, if we practice this art and skill of observation, we can come across so many new things, which if we broadly look into some subject or object, we will tend to miss. I just wanted to share this, the student, the fish and Agassi by a student, this classic lesson, so that I imprint on your minds how important, how hard and how difficult and time consuming this art is, which we usually listen all the time, but we usually tend to ignore. So welcome to the session. Let us continue the session further. Not only this art of observation is important all the time, this phenomenon we observe is happening around us all the time, but our master, our founder of homeopathy, Dr. Christian Frederick Samuel Hahnemann, all the time has emphasized in his organon of medicine for the physicians with the emphasis on this observatory skills by foremost telling all the physicians to be unprejudiced. How he has told us to be unprejudiced observer, we will be learning in the coming session. Before going into the further detailing and case discussing, let us first start by the literal meaning of this word observation. What observation means literally? It is an act or instance of noticing. It is an act or instance of attentively watching, the habit of observing and noticing, an action or process of closely observing, like we understood in that epic lesson, monitoring something, monitoring somebody. This is what we understand by what observation is. And how do we observe? We living beings, we have these tools of observations. With the basic tools by which we are born, we living beings are born, is the sense organs. We observe with the help of all the 5 sense organs we have, by the help of the sight, by hearing, by touch, by taste, by smell. All these sense organs, they help us to observe, to make an observation about any phenomena happening around us in our surroundings. We see at an object. We capture the sight of an object. So when we are capturing the sight of the object means we have seen an object. Whether we have paid attention to that or no, but we have seen an object. Then we look. When you look at the object you have seen, you sense a feeling about that object or about a phenomena you're observing. So you see means you capture, then you look means you're looking at something with a sense of feeling, a feeling which can be various emotions like joy, like gratitude, pride, inspiration, whatever feelings you have. So when we use that feeling in something which we look at, we use our mind along with the feeling of sense. It means we have observed a phenomena or we have observed a subject or an object. Let me explain this to you with a very simpler example. Suppose I saw my principal today in the morning around 8:30 going into his cabin. I looked at my principal entering into his cabin with the bundle of files in his hand. Then I started feeling that I saw him, then I looked at him, then I felt that he was carrying those green color files, which actually happened to be the case recording files of our OPD. Then that made me think, why is the principal carrying those green color files in his cabin, where these are not supposed to be in the college, but they are hospital property? Why is he carrying the hospital case record files to his college cabin? Then I started thinking, is he working on some case series? Has he some class today where he has to represent all these cases which he might have consulted in the OPD? So then I made an observation about that phenomenon of the principal entering into a cabin. That was a complete set of observation that I made. So you see, then you look, then you feel, then you use your mind to analyze that situation, means you have actually observed a situation. This is what Dr. Hahnemann has also mentioned in his organon, in his philosophy. But how does this mechanism occur? How is this mechanism of observation happening? How do we observe? Are there some rules? What is it? Along with the 5 senses, along with the cognitive factors which we already have stored in our memories, we make an inference, we make a concept, and then we understand something, and then we act upon. That is what we observe, a phenomena, and then we act according to the situation, right? So there is this social learning theory, a theory which was given by Albert Bandura, who is a professor of social studies of psychology in Stanford University. We will not go into the detail of this social learning theory because it might take more time. But in a nutshell, I'll explain you what social learning theory says. He explains that how all these environmental factors, how all these cognitive factors helps or influences a human learning and a human behavior. So all the factors from the environment, all the factors like cognitive factors, factors which are already saved in our brain, factors which we utilize by understanding and thinking, and our past ideas and past knowledge and information stored, how that affects our behavior, our learning. All these factors helps us to observe a phenomenon around us. Dr. Albert Bandura has given 3 models: a live model, a verbal instructional model, a symbolic model. In the live model, he says that observing an actual individual perform a behavior. In the verbal, listening to the detailed description of behavior and then acting based upon that description. Symbolic is like the multimedia, the books, the movies, the television, the online media. Through that, we understand a behavior. Through that, we understand a demonstrated behavior. So observation of an actual individual perform a behavior, or listening to the detailed description of a behavior and then acting based on that description, is what we homeopathic physicians are coming across daily in the clinical setup. That phenomenon of case taking which happens in our clinical setups. The live model and the verbal instructional model is a true example of that. So how important observation is, we really need to understand that. Why? Because our master has mentioned the importance of observation in homeopathic philosophy very, very clearly through the aphorisms in the Organon of Medicine, where he says that the true and only conceivable form of disease in its whole extent. We all are very, very aware of these terminologies because this is totally taken up from the aphorisms of Organon. The true and only conceivable form of a disease in its whole extent, that is the portrait of a disease, which we are ideally supposed to make when we reach to an analysis of a case, with the help of the signs and symptoms by the perceptible signs given by the patient and by the attendants of the patient to a homeopathic physician. And this portrait, with the help of the perceptible signs and symptoms and the attendant of the patient, should be considered by the physician, should be observed by the physician only in an unprejudiced way. Very, very clearly mentioned by the master, laid down all the principles very clearly in the Organon of Medicines. We should not miss these. So to be an unprejudiced observer is another difficult task to achieve. He has very nicely mentioned that the disease speaks to you through the language of signs and symptoms. Give heed to the language of the body of a patient. Observe what the patient has to tell you. Observe what the changes are occurring in the state of the patient. All these are mentioned from the aphorism 1 to 10 in the portrait of a disease by the master in the Organon of Medicine. But then, how should we be the unprejudiced observer? How should we be free of our own prejudices? We take the cases daily. We listen to the ailments, we listen to the complaints, we listen to the life space of the patient all the time when we are taking a detailed case. We get along with those cases. Most of the time when we are listening to the patients, we connect to that story. Either we connect his story to some Mr. X we listened to in the past, to some friend, to ourselves. So then we start becoming biased from here itself. We will never be able to disconnect the patient story to our cognitive stories, the stories which are saved in our cognitive memory. For that, we should work on ourselves. So there is this very important self-awareness window, Joe Harry window. I can't take that window, explain that window to you in detail. You can take note of that Joe Harry window model, which is to build a better self-awareness of your conscious and subconscious biases. Please go through that Joe Harry window. It will help you to assess yourself. It will help you make aware about yourself, about your blind spots, about your weaknesses, about your strengths. I cannot explain that in detail because we have limited time slot, but to know thyself, that is one of the best means right now, shortest and the best means. Because if we'll work upon ourselves, if we will know about ourselves, if we will work on our personal development, and if we'll sharpen our skills, to understand another person, then we will justify all the aphorisms mentioned by the master, as is very clearly mentioned in aphorism 83. Attention in observing and fidelity in tracing the picture of the disease. So not only attentively we have to observe the patient, we have to trace the picture with full honesty and loyalty. We can't do that if we don't know thyself, if we don't know ourselves, if we don't work upon ourselves, if we don't differentiate our biases to the patient's story. So that is one important step to be an unprejudiced and unbiased observer. That is the need of the hour. So for that, if my friends, you want to, please go through Joe Harry window model. The whole homeopathic philosophy is about fitting these two blocks, a block of what is to be cured in the disease to a block of what is curative in the medicine. So if we are able to fit these two blocks properly, that what is to be cured in a disease to what is curative in medicine nicely, then I feel we are successful in achieving the cure. To be more precise, in a homeopathic term, restoration of health as it is. That is the ultimate. That is the minimum we all strive for. And if we fix these two blocks, what is to be cured and what is curable in a medicine, I think we will achieve that. But for that, the basic tool, as in the steps of case taking, everybody knows that the first step of case taking, in homeopathic case taking, is observation. So if we start this observation without being biased, we will develop this art and skill over a period of time. We will practice this art and skill over a period of time, and we will learn how to keep aside our biases and listen to the patient's life space. Then we will be able to give the simillimum in a better way. And to learn the importance of observation in homeopathic practice, I think evidence-based learning through few cases can be looked forward to. Let us discuss a few cases. Because case studies are the ones which tend to focus on why and how to apply a skill, to apply a concept, rather than just, remembering the facts and remembering the datas, so details of anything. But before doing that, let me just share a few tips with you for how to approach towards a case study. When we are doing a case study, make it sure that you read that case for at least 3 times before you start analyzing that case. Because these case studies usually have such detailed material, such micro detailing, and then we easily miss something when we read it for the first or for the second time. So read it and reread it. Once you're thoroughly familiar with your case, then you note down the facts. And then you note down the facts which are most relevant to your case. After noting down the relevant cases, you will come to know that there are so many facts in that case, so many micro detailing about the case. But you utilize the most relevant, like we in homeopathy do, by differentiating and by observing the qualifying symptoms, common and uncommon. That all I really need not discuss. We all are physicians. We are practicing homeopathy since long. This is mainly for the students who are listening to the lecture. So let us come to the first case. This was a 10 months old boy who was brought in the casualty somewhere around 7 p.m. in the evening by his parents, traveling almost 60 kilometers in a lot of desperation. The child developed sudden dyspnea with audible wheeze since evening 4 p.m., along with the cough and fever. The parents were a resident of Bangalore and the parents were firm believer of homeopathy, so they got the child in this acute state to the homeopathic hospital. Then these complaints started in the afternoon with mild cough and fever. By evening 4 p.m., the child developed dyspnea with loud audible dyspnea with the loud audible wheeze. The past history of similar episodes happened twice where the child was hospitalized for 3 to 4 days. On examination, audible wheeze, temperature was high, 101 degrees, heart rate was 160 per minute, respiratory rate was 80 per minute, no cyanosis, suprasternal notching, intercostal retraction, subcostal retraction, flapping of LNSI, wheezing, crepitation, stridor, heart sounds were normal, every liver and spleen were 2 centimeters each. On X-ray, we saw straightening of the ribs with hyperinflated lungs. On observation, the mother very nicely told us that whenever the child used to sleep, his wheezing used to subside. That was the mother's observation. The observation in the ward was that the child used to sleep on the back with outstretched arm. According to the mother, usually the child sleeps on the side, but what was observed in the ward was that he used to sleep on the back with outstretched arms. The totality formed was respiration, whistling, awake when, dyspnea, better, lying on back with outstretched arms, dyspnea, better, sleep, during. Susceptibility assessment, moderate to fast was the pace of the child, structurally reversible pathology, high sensitivity, characteristic symptoms were present, prescribed on the keynote basis, tuberculomyism. The infant was prescribed Sorinum 200, 4 doses, 4 hourly, followed by Sorinum 1M, single dose. Within 12 hours, audible wheeze was better. Respiratory rate came down to 50 per minute. Chest showed harsh breath sounds. Within 24 hours, no audible wheeze. Respiratory rate 36 per minute. Chest was almost clear. The child was active and playful. So this is how the observation of the mother, how the observation in the ward helped us to form the totality of these 3 symptoms. And we gave Sorinum on the basis of the totality. Because in this acute attack phase, we just cannot go into deep detailing of a patient. So very keen observation, very close observation is usually the need of the hour in handling such kind of emergency cases. We can't rely on detailing of a case taking in such conditions. That is how observation matters. When we observe something, we not only see what it is as it is, but what we see is that, there are patterns which are forming. We see the formation of pattern in any kind of observation, what we observe in our surroundings. We are able to analyze the context of what we are seeing. Then we make connections that associate one observation with another. We find that, one observation is connected to the other. And ultimately, we are able to conclude, and whatever we'll conclude on this basis will not be far from reality. We will stick to the exact thing which is happening, exact behavior. So let us look into one another case where we will be able to understand this pattern formation in a better way. The second case is a case of agonizing joints. A female, 23 years, married, reported in the casualty. The chief complaint was sudden acute pain in one knee. After 15 minutes, pain in the other knee. Severe myalgia. Severe hip joint pain in few hours. Weeping along with the pains. Patient was abusing, screaming with pain. The husband carried her in the arms, literally to the casualty. The relatives were accompanying the husband, carrying, a wife in pain, in a very panicky state. The whole family was panicked. The whole scene was very, very dramatic. Hospitalization was advised. The observations were made keeping in mind the clinical progress of the disease, anticipating the complications of the patient, keeping in mind the characteristic symptoms, considering the patient as a whole. The investigations were done to differentiate other diseases. Socially, assurance was given to the patient and to the relatives because they were in a very panicky state. Therapeutically, the patient was managed with medicine to manage the acuteness of her pains. The observations which were made were, the patient needs attention. When one joint is better, pain shifts to another joint. Pains wander and alternate. Hypersensitive to pains. Mourning with the pains. Pain aggravates on slightest touch. Pain slightly better with warmth. The history. Episode of a viral fever happened in the recent past with the female patient. The joints were warm to touch, minimal effusion. There was painful restriction of the movements. No murmurs, no skin lesions, no nodules, no liver spleen palpable was seen on examination. Investigations were advised. CBC total WBC was 6,200, neutrophils 55, lymphocytes 41, eosinophils 3, monocytes 1. ESR was 44, C-reactive protein was positive, ASO was negative, sickling test was negative, uric acid was 4, alk phos was 50.5. Shall I repeat the observations? Or has everybody gone through that? This is a totality which was formed on the basis of all the observations. Oversensitive to pain. Irritability, pain with. Wandering pain here and there. Alternating states. Pain aggravates touch. Pain better warmth. Actia racemosa was the drug given in infrequent doses initially, followed by 10 mg single dose. The patient was 75% better and the patient went home walking. The whole panicky situation was handled only on the basis of close and keen observation of the patient. Not only this is why observation is important. We take care of such kind of cases where the patient is not in a state to elaborately give you his case. But as I told you initially also, that in today's scenario, because of lots of diagnostic skills, diagnostic tests, we are misdiagnosing the patient, or we being physicians, we are taking lots of time in diagnosing the cases. We are delaying in providing the right treatment to the patient. And how does that affect? This delay in diagnosis can be explained by various factors which are happening in the past decades, like the lack of continuity of care, like poor communication among the healthcare providers, like a general decline in the observational skills by the physicians, history taking skills, physical examination skills, clinical reasoning skills, which all require a solid fund of knowledge, practice, and experience. So we should not allow these to limit our observatory skills and to not impart proper care and treatment for our patients, because they come to us to seek help and to seek right treatment on the right time. So let us focus and work upon our observatory skills, my friends. Let us discuss one more case where we will learn how delaying a case or delaying diagnosis deteriorated a patient. So a patient who was suffering from, who came with the presenting complaints of fatigue, weight loss, and pain in abdomen, was very much concerned because his symptoms were deteriorating and his ability to work and earn money was deteriorating gradually. So he was very much concerned. Only 3 complaints he had: fatigue, weight loss, and pain in abdomen. And he was very much concerned because they were disturbing him. Why? Because they were impairing his ability to work and to earn a living. The patient had history of histoplasmosis. The patient visited various hospitals multiple times with the similar complaints. All the tests and imaging studies were done. On observation, it showed that his skin had an unusual tan from his face to his hands. It was observed that his knuckles were very, very dark compared to the surrounding skin of his hands. On further physical examination, hyperpigmented gingival patches, black longitudinal nail bands, and darkened palmar crease were also noticed. If we read this case, as I told you, read at least 3 times. If we read this case, the diagnosis is very simple. But this patient has been to various hospitals, all the tests, all the expensive tests were asked by various physicians. And he roamed and from one clinic to the other. But if we go back to basics, if we look at the basic symptoms, we will understand that the hyperpigmentation of the skin unmistakably pointed towards the diagnosis of adrenal insufficiency, especially when we consider association of fatigue, weight loss, and pain in abdomen. So how his right diagnosis was delayed, how he was restrained from the right treatment at the right time, just because we have developed that habit of not taking care of our patients by our observatory skills, but by relying more on today's techniques and modified medical aids and modified diagnostic aids. So we should stick to the basics. We should start relying on our own observatory skills. That is how we should work upon. There is one more case which will further enlighten, or which will further give us an evidence how observation is very, very important. And I think after this case, we shall discontinue today's session and we can continue the session on coming Monday. So this case was a male baby who was unconscious, who was referred from Palghar PHC for emergency NICU management on 18/6/9 at 10:35 a.m. in the morning. A precious child born to a couple after 12 years of marriage. Chief complaint, not responding to the stimuli, no cry since few hours. History of fever and refusal to feed since last 3 days. So the child had fever, the child was not taking any feed since last 3 days, the child was not responding to any stimuli, there was no cry since last few hours. The child was a very precious child because he was born 12 years after the marriage of his parents. In the OPS history, the baby conceived after 12 years of the married life. The birth history, antenatal history went uneventful, preterm, vaginal, home delivery. The child cried immediately after the birth. On examination, no spontaneous activity was seen. No cry to any painful stimuli. Basal crests were present in the respiratory system. S1, S2 were normal in the cardiovascular. Perabdomen was soft. CNS hypotonia. Pupils were sluggishly reacting. Reflexes were absent. Anterior fontanelles were boggy. This is the image of the child. Hypotonia, sluggish reactions, absent reflexes. Temperature was 99.2, heart rate 140 per minute, respiratory rate 56 per minute. Meningitis with septicemia, with hydrocephalus. Treatment given by the pediatrician. Continuous oxygen, antibiotics, monosef, micacin, pipzo, soda bicarb, Rantac, IV fluids. Routine treatment was given. Response in 24 hours after the intervention given by the pediatrician. The GC was same. Temperature 100 to 101 degrees. The temperature was 99 earlier, now it is 101. No spontaneous activity, no cry. Pupils were dilated and fixed. Developed a sunset sign. You can see the sunset sign. Conclusion. Disease was progressing. Hydrocephalus was increasing. Poor response to the treatment. Pediatrician assessed the child as brain dead. No use of any medication. He advised the baby to take the baby back home. No medical intervention required. Now you imagine the state of the couple who conceived after 12 years, for whom this was their whole life. Now you imagine their situation, parents' mental state. Precious child, very much worried about the baby. Poor family, but they were not willing to give up. They wanted to continue the treatment. They were not willing to go back home. Scope of homeopathy. Understanding the role in critical life-threatening situation. Observation. Now see the importance of observation. Baby, unconscious, no activity. Cry, not cried even after painful stimuli. Anterior fontanelle tensed. Sunset sign. Clenched fingers, you might have seen, I showed you in the picture. Closed thumb, that also I showed you. If you want, I can go back. dilated pupils. Baby passes urine 2 to 3 times in 24 hours. On examination, the bladder was palpable and distended, but he passed the urine just 2 to 3 times in one full day. Totality. Unconscious, coma, hydrocephalus in. Eyes turned downward. Clenched fingers. Closed thumb. Bladder paralysis. Dilated pupils. If you want to go through again. This was the repertorial totality. Remedial differentiation from cupramet, helleborus, hyoscyamus. If you want me, I should take this or I should skip it. In hyoscyamus niger, what we see loss of consciousness due to cerebral congestion. We see dilated pupils, we see clenched fingers and closed thumb. We see retention of urine, bladder, and paralysis. Susceptibility. Meningitis with hydrocephalus was the pathology. Vitality was totally compromised. Characteristics were very, very few. Potency selection. 50 millismol potency. Why? Because of involvement of vital organs, because of poor vitality, need to accelerate the cure by giving frequent repetition, less chance of aggravation. Last hope. Hyoscyamus 0/1, 2 drops, stat dose at 10:15 p.m. on 19th. Wait and watch. After 2 hours, the follow-up symptom. On 20th, activity at around 12:45 a.m., moved all the limbs on stimuli. At 3:45, activity improved. Cry, the child cried for 30 to 40 seconds on stimulus. At 1:15, we still had hypotonia. Withdrawal response to tap on the sole, dorsiflexion of the toes. Blink to light was slight. Pupils' reaction to light was sluggish. Urine 3 times. That was around 12:45. We gave the medicine at around 10:15. Now at 4:45, activity further improved. Cry 30 to 40 seconds, which was not on stimulus, but which was spontaneous. Improved partially flexed limbs. Withdrawal response to the tap on the sole was same. Blink to the light improved. Pupils' reaction to the light was same. Urine almost same. Then at around 7:15 a.m., we gave the second dose. Activity, same, moving on stimulus. Cry, same, weak on stimulus. Tone, hypotonic. Withdrawal response, dorsiflexion. Blink, improved. Pupils' reaction to light, sluggish. Urine, not passed since 12 a.m. 8 p.m., spontaneously moving the limbs. There was spontaneous cry. Improved flexion of the limbs. Withdrawal response was improved. There was flexion at the knee. Blink to the lie was improved. Pupils' reaction to the lie was same. The child passed urine after 12 for 4 times. This is at 8 p.m. Normal activity within the next 24 hours. The child was put on breastfeeding within 48 hours. A child who was refusing any kind of feed. Child discharged on the 4th day. Of course, this is not the child, but the child was hale and hearty. So this is how the art, the skill of observation, not only helps us in our routine case-taking phenomena, but also it helps us in management of such emergency situations where the family is in a panicky state, where the patient is not in a state to explain, where the patient is an infant. We really need to develop the keen observation to observe all the minutest and micro detailing of the patient. I think we should
Yes,
rest the session for today.
yes,
And we
yes.
should continue the session on the next Monday, that is 4th, the same time, 8:30.
Yes, yes. The time for discussion, those who would like to participate, please raise your hand. Dr. Venugo already is there. Yes, sir, we can unmute now, please.
Okay, BAINU ji.
So,
Okay, BAINU ji, that is, you are a great communicator. I am a modern medicine physician. I joined from USA.
so
Now, about the observation skills, I agree with you, and I would like to give 2 reasons. One, a significant number of doctors, they lack that observation skills. That's a fact. Significant number, I didn't say all. And number 2, and especially those who are working in the government hospitals, I know in Kerala, because I was in Kerala,
okay.
and they have to see 40 to 50 patients in 3 hours. So the time, they don't have that, like, the time is one of the resources you require for doing all this observation. And when there is no time, they will rush and give medicines, or they may send the patient for some investigations. And in the private hospitals, now these days, mostly investigation-based medicine, because they are not there for charity work. They are there to make money. So they will order all these CT scan, ultrasound, all sorts of investigations. And if you do an investigation on BAINU ji or even Dr. Manoj ji, without any health problems, you will find some results showing abnormal range. Then you start treating the lab abnormalities. So that is what is happening. That's
There
a
are various
ugly,
factors
that is
actually.
that is an ugly fact, ugly truth. Then one question I would like to ask you, that is about that knee pain, because I'm a modern medicine man, I was not able to understand what that medicine was given, some actinicia or something like that. Was it was it a painkiller or something else?
Sir, basically the medicine, the basic, when we study homeopathic drugs, we have the basic sphere of action of the drugs. So the sphere of action of Actia racemosa is on the ligaments and tendons. And considering that, along with the attention-seeking behavior of the female, which looked very hysterical to us when she was coming to the casualty,
Okay.
Actia racemosa is again a very, very important drug for hysteria in female. Observing her whole aura and the whole scenario, Actia racemosa was given to her. And
So it was more than an organic health problem. It was more of a
it was
functional
more of
problem.
a psychosomatic issue.
Psychosomatic hysterical. Okay, so that is what I wanted to. Because you are saying that wandering pain or could be fleeting pain, that rheumatic fever also can give that kind of a pain. So I didn't know about that medication. I got it. And then about the dyspnea, you were talking about the dyspnea. And this is because I'm a person, luckily, I had the very good training when I was in the medical college as well as when I was in UK for my MRCP, the training. And I don't rush to order investigations. And in USA, if a patient comes with a dyspnea, you're talking about dyspnea, and a cough, and the first thing they do is they immediately call the respiratory therapist to assess the lung function. And the respiratory therapist, he spends some 10 or 15 minutes and the time delay, then he does that function, then give the treatment, then before he discharge, again do the respiratory therapist function. I never used to do that one. All I used to do was, I observe. That is, if a person can speak one sentence, whether he can speak one sentence without taking a breath. Suppose he says that, okay, I'm not able to breathe. If you say that I am not able to breathe, even one sentence, I document that one. Give the nebulizing treatment, whatever is required. Then 2 hours later, then I go and talk to him. And if he is able to say, and now my breathing is better. Yeah, I can. Yes, that is enough. No need to call the respiratory therapist.
Okay.
So that is observation,
That is observation.
documentation.
True.
That's what I used to do. Thank you. It is a good
Okay.
session.
Yes,
Thank
thank
you.
you, sir, for your comments. It is really the personalized medicine in full swing we can see in homeopathy. Anyway, I would like to would like to ask some questions. Somebody is there. Please raise your hand. Only 2 minutes remaining. You presented 4 cases and 4 are totally different. And what is to be cured in disease? In each case of disease, that's the most highlighting word given by Hahnemann. And recently, the medical world is also treating that way to tailor the case or to personalize. We have already described this as individualized medicine. Now they christen it as the personalized medicine. The personality is there. In fact, it is a manifestation of the genetic quality. There is no doubt about that. And because the medicines are the potentized form, definitely we can address all these things. Anyway, it's a wonderful presentation. And you remember that you will have a second session on the part 2, the 4th November coming day. Time for wind up the session. May I invite Dr. Bob Lim to express a lot of thanks. Dr. Bob Lim, please. Are you sleepy? It is around midnight in Dr. Bob Lim. Yes, Dr. Venugopalan, sir, please unmute. Yes, sir. Yes.
Okay. Bainuji, you were my fish during your presentation. You were my fish. I was observing you. Your dress, that one is black color, and your bindi, that is black, and your glasses frame is black. From that one, observation, conclusion, you love black color. Thank you.
Thank you, sir. It was actually an appropriate one, I guess. Perfectly.
Yes. So be careful about these observations in the platform. Okay. Anyways, nice presentation. And on behalf of IFPH, expressing sincere thanks to Dr. BAINU SHARMA and all those participating in the session. Hope you then will be back again tomorrow. Till then, goodbye. And Dr. Mariama John to continue the program in Malayalam.
Goodbye, everybody. Good night.